Well, good evening and welcome. It's Wednesday, the 28th of July. Now, I'm looking mostly at the UK and the United States today, but let's just start off with a bit of orientation. Now, very hard to summarise this. Certainly cases are going up dramatically in the United States. And the United Kingdom is going to require a bit of discussion. It's not a simple answer. So let's look at these orientation slides first of all. So Australia, unfortunately, the Sydney outbreak is continuing to increase. Now, that is very worrying indeed. Canada's good. New Zealand, of course, is down at the bottom. Now, this is the United States line here, and we see a definite increase. About the same levels of South Africa now, coincidentally, which is decreasing. Ireland, increasing in Ireland. Netherlands and the United Kingdom both going down nicely, although the United Kingdom's up very slightly today. How reliable are these figures based on the testing? Well, we can see that the United Kingdom is testing significantly more. Australia's testing a lot, albeit very concentrated and localised in New South Wales. Then Ireland, Netherlands, Canada, South Africa testing not that much. And the United States also not testing that much, interestingly. So if anything, the figures from the United States, based on what we're seeing here, must be somewhat underreported. Finally, moving on to vaccinations. Here we have the vaccination. Now, South Africa, of course, it's been fairly disastrous, really, the vaccine rollout. All sorts of problems. Australia picking up, but slowly. Still a bit of a stroll out in Australia. United States almost plateauing. Ireland, Netherlands, typical of European countries. The vaccine supply is so much better now in European countries. Great to see. Then the United Kingdom and Canada are actually leading, and that's actually COVID-19 vaccines doses administered per 100 people. Of course, the figures are going to vary a little bit, whether you're looking at vaccinated people, partly vaccinated people, fully vaccinated people. Does change a little bit. Now, coming on to some of the detail now, there's been an important paper out today or yesterday from the Centres for Disease Control, Science Briefing COVID-19 Vaccines and Vaccination, updated yesterday, the 27th of July. So some pretty, well, to tell you the truth, not a lot massively new. But we do need to get the confirmation from the Centres for Disease Control, because that's basically what we have to base American data on. But they do tend to come into the party a little bit late quite often, but we'll come on to some of that detail in a minute. First of all, let's notice in the States, as we've been predicting for some days on this channel, the Centres for Disease Control has basically done a 180 on mask wearing. So fully vaccinated people should resume wearing masks indoors, they are saying. Now, K-12 is kindergarten to year 12, so we don't have that sort of description in the UK. But it basically means all of secondary school age from kindergarten, which presumably is 4-year-olds or something, all the way through to 15, 16-year-olds. So it basically means through the whole school system. They are saying that that basically everyone should wear masks indoors, teachers and pupils. That's from the CDC again. Areas of high or substantial transmission should be following these rules. And that's 63.5% of states at the moment. And if you go onto the CD website, it gives you a map of the country. Fully vaccinated people can still catch and transmit the Delta variant. Now, that is now stated. Of course, we've known it on this side of the pond for some time. But now the US authorities have confirmed that. So that is now true in the States, because the CDC have said it. 100 million people are eligible for vaccine who have not been vaccinated in the States. So what's going to happen there? Not looking particularly promising, really, for quite a few Americans, I'm afraid, who are at risk of getting severe disease. Now, talking about breakthrough infections, this is the idea that fully vaccinated people can still get it if the infection breaks through. CDC have said risk for SARS coronavirus 2 breakthrough infection in fully vaccinated people cannot be completely eliminated. Well, no, we know it happens. So a very conservative turn of phrase, but it's correct. But we do know it happens. People fully vaccinated with an mRNA vaccine are less likely than unvaccinated persons to acquire SARS coronavirus 2 or transmit it to others. Well, yes, again, and we've known that for a while, but it's nice to see the CDC being clear about this. So they're less likely to transmit it to others, but they still can, as long as there's continued community transmission of the virus, which unfortunately in the United States there certainly is. So again, I mean, in some ways these CDC pronouncements are looked on with a little bit of curiosity from other places because they're so behind the times, but nevertheless we'll go with it. Onward transmission for people vaccinated with onward transmission from vaccinated people, according to the Centers for Disease Control. Right, they say there's multiple studies from different countries, and they do give all the references for that, so this is well referenced. And this is particularly data for the Pfizer-BioNTech vaccine, although I would expect the Moderna vaccine to be pretty similar, and the other one's not too far out. People who've developed COVID-19 have a lower viral load. So there you go, lower viral load, which in turn may indicate reduced transmissibility. Well, again, they're being very conservative in their language. It just seems patently obvious to me that a lower viral load will reduce transmissibility. So they're being very scientifically cautious, I suppose, but they really are a bit behind the times. But anyway, so we believe it most certainly will. They're saying it may significantly reduce the likelihood of transmission from vaccinated people to household contacts. Now, this is two pretty big studies from the UK, actually. And we found that people who were vaccinated, particularly with the Delta variant, were much, much less likely to pass it on to other members of their household who were unvaccinated. Whereas people if one infected person got Delta variant in the household, invariably, really, all the other members of the household got it. So the vaccinated person was protecting those in the other household. So we know that, and we think the reduction in the UK is about 75% in transmission overall. US vaccine efficacy is they give figures on this. Pfizer and Moderna, 86 to 89% protection against infection. So that's presumably, they don't actually say that. That presumably means symptomatic infection. Asymptomatic infection, 80% protection. So what that means is there's still a fair old risk there that people can get it asymptomatically and, of course, transmit it on to others. So that risk is still most certainly there. US protection against hospitalisation. Now, what they're saying on this site is all authorised vaccines give 89% protection. I think what they mean by that is the Johnson & Johnson vaccine, the Janssen vaccine, probably gives that after one dose. But the Pfizer and Moderna, they're quoting 96% protection against hospitalisation. Very good figures. I mean, even that's a good figure. So good protection against hospitalisation. Again, US data here confirming what we've known for quite some time. US protection against death, not actually given. We believe it's 98, 99%, but they say it's high. So how does this compare to other countries? Well, Israel, protection against any infection is 92%, protection against symptomatic infection 94%, protection against severe disease 82%, hospitalisations protection 87%. So, yeah, fairly comparable figures, isn't it? Fairly comparable. And of course, Israel was primarily Pfizer vaccine, of course. So interesting that different countries, using different methods of data gathering, are coming to within a few percent of each other on efficacy of the vaccines, which is encouraging. Both in indicating to me that the data collection techniques in Israel and the United States are both probably accurate. Now, there's been a lot of fuss about antibodies and immunity. But as we've always said, vaccine-induced cellular immunity of the lymphocytes is particularly important. Now, this is data from the US for the Moderna and Pfizer vaccine recipients. And they looked at the alpha, beta, gamma, epsilon variants. And what they found was, this is the CD helper cells, and this is the CD cytotoxic cells. Remember, these are the lymphocytes. These protective white blood cells, these protective leukocytes, the lymphocytes. So CD4, they're the ones that are affected in HIV, actually. The human immunodeficiency virus challenges those kills those CD4 helper cells. And the CD8 helper cells are the ones that directly kill virally infected cells. And what they found is, although there was variations in the antibody numbers, that there was modest or no deficits in cellular immunity recognition of the variants. So this is actually interesting, and something just sort of clicked in my mind when I read this. Well, I thought, well, if you don't get this difference in the cellular response between the variants, and you don't get this, and the protection for all vaccines is good against severe disease and hospitalisation, then it's these immune cells rather than the antibodies that are protecting against severe disease and hospitalisation. So that is probably what's happening there. So, and the other thing about this is the longer lived response. So the antibodies only hang around for a few months. These cells, the memory cells in here, can hang around for decades. Well, not hang around. They're designed to provide long-term immunity for decades for some infection. So I'm still optimistic about this long-term protection against severe disease, hospitalisations and deaths. I remain optimistic about that. And data from Israel did show that although people got several months after vaccination, especially if there was only the 3-week gap, that they still got infections and symptomatic infections, but they were still protected against severe disease, hospitalisations and deaths. So I'm hoping that's going to last for quite some time. And we did say that the reason that, or we believed here, that the reason that we're seeing a recurrence of infections in a lot of people in Israel, whereas much fewer in the UK, is because there was only a 3 or 4 week gap between the 2 doses of vaccine in Israel, whereas in the UK there was a much longer gap. And of course, the gap between the vaccines in the States was only typically 4 weeks. So I'm expecting to see more infections in the United States following the Israeli pattern rather than following the UK pattern, where there's a greater protection against infection. And of course, that's got obvious implications for spreading the disease to the unvaccinated, which is the major threat. These 100 million people in America who are at risk of getting severe disease, hospitalisations and deaths. And this is going to increase over the next weeks. This is really quite a concern for the United States, to be quite honest, because of the large numbers of unvaccinated people. So basically, they stayed much the same regardless of the variant, which is good. And they did say cellular immunity may help limit disease severity, which of course is true. Now, the United Kingdom, what is going on in the UK? It is a bit strange. Let's just look at the daily summaries here. Now, vaccinations are still going well here, but we did see a slight uptick in cases today. But hospitalisations, of course, are completely vital. And we are seeing an increase, but still manageable amounts of people in hospital. And people in hospital are tending to be less sick. So there's 6,000 people in hospital there at the moment with COVID. And they're tending to stay for not as long. So quite a few people being admitted, but the overall number in hospital not increasing as dramatically. Certainly nothing compared to the previous peaks. So slight increase in cases today. We have had this nice gratifying reduction in cases. I mean, just look at that graph there, that reduction in cases, because I'm going to come on to something about the COVID symptom tracker data in a minute that really does bear a bit of closer inspection. Now, what we had in the UK was we had this nice, so the peak there was on the 17th of July, 54,000 cases. Then down for quite a few days, the last few days, 24th, 25th, 26th, 27th, down, all down. Now, we did say that this data on the 27th could be a little underestimated because it came from, still partly came from the weekend. But so because that data there came from Monday, and it's always the data's always a day late. So the Wednesday data for Tuesday, 27,000. So from 23,511 up to 27,734 after this nice reduction on a daily basis. It actually went down for 7 days consecutively, which of course was very nice to see. So slightly up today, but only a little bit, to be quite honest. I mean, let's see what tomorrow brings. But I'm expecting this to go along fairly low this week for the next few days. But then Friday, Saturday, Sunday, Monday, Tuesday next week, we are going to see the effect coming through of the easing of restrictions from the 19th of July. So there will be things happening there. Now, let's just look at that graph again there. This is pretty interesting. That graph again there, right? So things going down there, that's cases in the UK. Now let's look at the COVID symptom tracker data. They're saying over 60,000. So the figures here from the official figures are 27,734 new cases. COVID symptom tracker data is saying, well, more than double new cases. Symptomatic COVID, interesting. And when we look at that graph there of the prevalence from the COVID symptom tracker data, we just see it going up and up and up and up. Okay, there's been a slight levelling lately. But what the heck is this difference? Because we've found the COVID symptom tracker data to be really quite reliable over the last 18 months nearly that we've looked at it. So what I did was I looked at the I meant to load it up actually, but I didn't. So we looked at this. So that's the COVID symptom tracker data there. Now the UK official symptoms there are still on there. I meant to put it up, but I forgot. But I did check it a couple of hours ago, and it was still persistent cough, fever, and anosmia. So basically, the symptoms on the official government site are out of date with what's actually happening. Pathetically so, because these are the current ones that we've looked at several times. People that are vaccinated, runny nose, headache, sneezing, sore throat, loss of smell in that order. Unvaccinated, headache, sore throat, runny nose, fever, persistent cough. So the government website is just way out of date. So I think what is happening is that because these are the COVID symptom tracker data features, I think the COVID symptom tracker data is picking up a lot more people. And of course, they correlate these with people that go to get tests. I think the COVID symptom tracker symptoms are more accurate than the government symptoms. So they're picking up more cases. Now, if that's the case, if that's the case, then that means that this is the more accurate figure. But having said that, we do know that the hospitalizations are accurate. We do know that these hospitalizations are accurate. So in a sense, if the COVID symptom tracker data is correct, and we're getting a lot of cases, we're getting twice as many cases as the official numbers, but that's not being reflected in hospitalizations, and deaths are up a bit, but it's not being massively reflected in deaths, then that is probably a good thing in a way, because it means lots of people are probably getting the infection who've already had 2 doses of the vaccine. They're getting these kind of symptoms here, the more common coldy type symptoms. But of course, the reason I think it could be good news is because if someone's had 2 vaccines and they're re-exposed to the virus, that's a booster dose for them. They're being re-exposed to it, and that is re-stimulating the immune system. So in a weird sense, it could actually be good. So that could be what's happening. Having said that, I don't know that. Tim Spector hasn't given his update this week. I wonder if it'd be interesting to see if Tim Spector confirms that. But that could be what's happening. The government symptoms are simply out of date. Why don't they change their website to be up to date? It's just bemusing. Get your act together, government website. Right, there we go. So check that out, UK visual symptoms. Now, from Monday, doubly vaccinated EU or US citizens will not need to isolate coming to England, Scotland, Wales from an amber list country. So again, we're seeing clear, absolutely clear differentiation between the vaccinated and the unvaccinated. And of course, this will have to be proved. So just another example of how things are changing to discriminate. Or should I say differ? Discriminate's a word that's become a bit of a dirty word recently. I mean, differentiate. What's the difference between discriminate and differentiate? I suppose discriminate would be unreasonable, whereas differentiate is reasonable. So depending on your view of this, this is another way to discriminate or differentiate between the vaccinated and the unvaccinated. I'll leave that with you to ponder that one, but it's certainly happening, and you'll need evidence of your vaccination status. Now, we're going to do some community health work now with WFAFA again. Now, a lot of you have been following WFAFA. If anyone wants to contribute to his work, there is a link to do that there that I'll put in the description. Now, today WFAFA is looking after a newly diagnosed person with diabetes.
Hello guys, welcome to day 2 of the community. As I talk, we are now in the community and I'm here with my mama and our friend. I know you will get to know their names as I interact with them. I think we shall first begin by sanitizing. So, you will get to know the names of our friends that we are meeting today.
Before I started taking history, I first made sure that the boy has got my trust. I wanted him to get used to me, so my attention was focused on him. I made sure that he gets used to me in that shortest moment. And you will see later in another video, you will see that we became very good friends and we even planted seedlings with him. So at first I wanted that anxiety to go away.
Yes, viewers, our friend is called Ezekiel Mukono. Yeah, and then Mama has said that she's called Galenda Salama. So what we are going to do, we want to take the blood glucose level of Ezekiel, and then we also want to teach Mama about the diabetic diet, such that he will be able to have a controlled blood sugar. We also want to give out a blood glucose machine that will enable Mama to be monitoring the blood glucose of this younger boy, because as we all know, blood sugar monitoring is key in the management of diabetes mellitus. We want also to explain to Mama what causes diabetes, most especially diabetes type 1, because she has been having some unanswered questions. She has been wondering why is my child suffering from diabetes mellitus. So we want to do those things for today, and at the end of the session we shall also go and plant some seedlings, because we know that fruits are very important for people with diabetes. They help to control blood sugar, and at the same time they help to build the body's immunity, such that the body can be able to fight other diseases well. So now we are beginning with history taking. We are going to take the demographic data of our friend here, and we shall also find out more about the condition, when it began, and how it is taking the boy as of today. So let's begin the process.
After the boy has trusted me, now I started taking serious history, because at first I was just a stranger. I could not do anything. I had to first get his trust, and now he saw me as a friend, not just as a stranger in a gown. So I asked the mother what she knows about this condition, and she tells me that she knows nothing, that she doesn't know why his son got this condition, because in the whole family they don't have this condition, both paternal and maternal. Now I had to explain to her what causes diabetes mellitus type 1, I told her that it is due to autoimmune destruction of the cells that produce insulin within the pancreas. So I told her that sometimes, or most of the times, it is due to that, and it is secondary to a viral infection like measles. But when I asked her about history of measles, she told me that her child has never had measles. So maybe this could be just any other viral infection that she doesn't know, or that I also don't know. Yeah, but it could be due to that. Yeah, so that is what I told her, and told her about some of the signs and symptoms, and she told me that yeah, that's what she saw in her child. She told me that actually they tried to treat this child and he was sickly all the time. They tried to treat, but the child was not improving. So when they tested the blood sugar, they found out that it was high persistently, like for a long time. So they diagnosed that child with diabetes mellitus. So I tried to bring it in a local language, and at least I left when she has understood, and she was very happy. So I thank God for sending me there, and I thank God for you all who supported us such that we were able to reach this family. Because if we had not reached this family and we explain what happens, the pathophysiology behind diabetes mellitus type 1, this mother, maybe with time, she could not follow the recommended treatment that the health workers are giving, simply because she doesn't understand what is happening. And that is common here when people get some signs like needle sensations, those signs they don't understand.
So Wafafa's calling that lady Mama there, which is just a sort of polite, respectful way to talk to her. I'll do the same with if I'm looking after kids at work, or say, right, Mum, can you hold the child while I look in the rear, or whatever it is. So, Wafafa made friends with his patients. Does your doctor make friends with you? It's some do, of course. Planting fruit trees is good. Blood glucose was high. He does test the blood glucose in a minute. And the blood glucose machine that he's now giving out to these diabetic patients, you paid for those, so thank you very much. And the child was diagnosed with diabetes mellitus type 1, which is an insulin-dependent diabetes, and he does in fact start some insulin treatment, although it is remarkably difficult in the villages. It's expensive and you need cold change and you need equipment. It's difficult, but he's working on that. So that's us for today. Thank you for watching.